So we're gonna go ahead and pull the string out. It's been 10 minutes, and this is the easy part, so you shouldn't feel any gag reflex. It's pretty quick. We do need a pair of glasses for this. And so to test the string, I usually wet a paper towel and take the pen. After and before every test, I kind of just wipe the pen on the wet spot, and then I dry it right there so that it's clean. And we have a board here that we just bought from Walmart that we will put the string on. We clean that, of course, after every test and before. And then we have our key right here. So we have our trash barrel. Are you ready? And we're just gonna tilt the head back just a little bit. I'm gonna pull the tape off. Sorry. Ready? Open a little bit. 1, 2, 3. Perfect. So there we are. And then I just take my pen and I just color. All the way up almost until the piece of tape. So this is green, so as we can see on the pH scale. Now the stomach all the way down here is about a 2, and the rest of it is green, so I'm gonna go ahead and call in Dr. McCullough and let him interpret whether we need to repeat the test again.
Okay, Ashley's completed the test. She'll call me in on something like this. Now, we also have Ashley, who's the patient. And this was a good example today of someone who's kind of nervous. She has gastrointestinal problems, but she settled down quickly after the slight gag reflex. Most people, it doesn't bother them at all. And if somebody really has a bad gag reflex, and when you're doing your exam, you'll know that from usually when you use your tongue depressor. But anyway, let's look at our stuff. She might call me in on something like this, because this is a maybe. We have a tiny bit at this here, right in the stomach, where it is down in the 1 and 2 range, but very quickly it turns way up here in the 7, 8, and 9. Approximately this would be the stomach. This should be all red. Now, in case of the patient today, they did not do a water fast of 12 hours, which is required, and you look in your instructions. She ate coffee and also what else did you eat? Okay, so that was just an hour or so ago. She should have a lot of acid in her stomach. She should be very red right through here. So this test here, I would probably redo it, fasting, so we'd get a good test. If she redid it and it was green all the way, we'd give her 2 caffeine tablets, wait 10 minutes, and redo the test, and it should come back to normal. Normal should be about 3 after that test. But you'll see this many, many times. This pH up here, this is the esophagus and up in the mouth, and that's all normal. This should not be red up in here, but from about down here. You can estimate that size with the patient. Start getting red all the way up the string, you're getting red, real bad case of reflux. You can see the test is very simple. The staff does it. Doesn't really require much time from the doctor. And it's one of the best tests in the country. It's an absolute necessity to have this information when you're dealing with gastrointestinal problems, but also if you're in natural medicine, any autoimmune conditions or any of your allergies and those type of things, that it's the #1 step with leaky gut. So wonderful test, simple and very inexpensive in the office.